All right, everyone, get ready. Because today we're doing a deep dive into something that really gets the heart pumping, figuratively, A&D, literally. We're talking hypertensive emergency, that moment when your blood pressure just goes completely off the charts. We're digging into a brand new medical review article that really unpacks this whole phenomenon. And let me tell you, it's got some seriously interesting takeaways, things that might just change how you think about high blood pressure altogether.
Yeah, what I found fascinating about this article is how it really cuts through all the noise and confusion that surrounds hypertension.
Mm,
Because high blood pressure itself, I mean, that's surprisingly common, right? It affects a staggering number of people. We're talking something like 1.3 billion globally. But here's the thing, a hypertensive emergency, that's a whole other ballgame.
1.3 billion. Wow, that's like everyone I know plus everyone they know. But you're saying only a tiny fraction of those people actually have what you call an emergency. I mean, that's kind of reassuring, but also a little confusing.
You've hit the nail on the head. It's only about 0.5% of emergency room visits that are actually due to a hypertensive emergency. And understanding that distinction is really crucial. Knowing when high blood pressure is serious, sure, but manageable, versus when it's a five-alarm fire, that's key.
Okay, so walk me through this. What actually makes it an emergency then? Is it just that the numbers on the blood pressure reading are crazy high?
It's a little more nuanced than that. It's not just how high your blood pressure spikes, but really whether it's causing what doctors call acute organ injury. That means your organs, and we're talking mainly your brain, heart, or kidneys, those vital organs, they're taking a direct hit, and it shows.
So it's like the difference between, I don't know, like a light rain and a flash flood. Both involve water, right? But one's just a minor inconvenience. Maybe you get your shoes wet, and the other can literally wash your house away.
Exactly. And to muddy the waters even further, the article actually challenges some terms we used to throw around a lot, like hypertensive urgency. Turns out, slapping that label on things often just caused unnecessary panic and made it seem like every time your blood pressure went up a bit, you needed to be rushing to the ER. When in reality, a calmer, more measured approach is often safer and way more effective.
So ditching those scary labels and really focusing on what truly needs that immediate emergency action, I'm on board with that. Now, the article also uses this other term, malignant hypertension. Oh, okay, that just sounds scary, like something out of a horror movie.
I know, right? It does sound pretty terrifying, and for good reason. Malignant hypertension is a really serious form of the condition that can cause some major damage to your blood vessels and organs. But even the way we define malignant, that's evolving. Doctors are moving away from freaking out over a single scary high reading and instead focusing more on, well, the long-term damage that's happening across different organ systems.
So it's not just about this one moment in time, it's about the big picture, the cumulative effect over time.
Hmm.
This is already making me rethink how I view high blood pressure, I've got to say.
And here's where things get really interesting, and this is a point the article really drives home. Sometimes that extremely high blood pressure you're seeing, it's not even the initial problem. It's actually a consequence of something else entirely, another medical emergency that's happening in the body.
Hold on, are you telling me that my blood pressure could be through the roof because of something else going wrong? That it's not necessarily the root cause itself?
You got it. Think of it like a stroke, for instance. Your body's suddenly under this immense stress, and your blood pressure, it skyrockets in response. The article calls this the chicken or the egg problem. Is the crazy high blood pressure the culprit, the main issue? Or is it more of a symptom of something else going on behind the scenes? And figuring that out, well, that's obviously critical because it completely changes how doctors approach treatment.
Okay, now that's really interesting. So you're saying in some cases, if you rush to lower the blood pressure too quickly, it could actually be worse, even dangerous, if you haven't addressed the real root of the problem.
Exactly. And that's what we'll unpack as we go deeper. We'll look at how chronic hypertension messes with your body's ability to regulate blood pressure, those red flags that tell you it's a real emergency, and how treatment needs to be really tailored to each unique situation.
Okay, I am hooked. Let's get into it. So we've established that hypertensive emergencies are nothing to mess around with. But for those of us who might be, living with chronic hypertension, what's actually going on in our bodies day to day? And how does that tie into why these emergency situations can be so tricky?
It's really fascinating when you think about what's happening under the surface. It kind of brings home how serious this whole thing is. Imagine this. Your blood vessels, they're like a network of highways, right? And in a healthy system, all that traffic, it's flowing smoothly, no problem. But with chronic hypertension, it's like there are constant traffic jams putting all this wear and tear on the roads themselves. And over time, that constant stress, Well, it really increases the risk of some serious damage.
Okay, so the roads, our blood vessels, they're taking a beating. That makes sense. But what about our organs? How do they handle this constant high traffic situation?
Well, our bodies, and especially our brains, they're pretty amazing at adapting. Think of it
Hmm.
like the sophisticated traffic management system. Even when there's all this pressure from the high blood flow, the brain can actually adjust and keep things moving. But, and this is important, there's a limit, right? There's only so much it can handle.
And that's when things can go from like manageable to kind of scary.
Exactly. The article really stresses that when you have chronic hypertension, it throws that whole finely tuned system out of whack. Your blood vessels, those highways we talked about, they become less flexible, more like, I don't know, city streets during rush hour. And your brain's ability to regulate all that blood flow, to direct the traffic effectively, it gets impaired. It's like all the traffic lights and road signs just stop working properly.
Oh, that's a little too real for anyone who's driven in a big city, I'm not going to lie.
Right. And here's the real kicker. This is where things get tricky. If you try to treat it too rapidly, if you try to fix it too quickly, it can actually backfire.
Because the body's so used to operating at this like higher pressure level,
Hmm.
lowering it too quickly would be like, what, slamming on the brakes on those jammed up city streets?
Precisely. You said it better than I could. It's like suddenly diverting all that rush hour traffic onto these tiny back roads that weren't built for that kind of volume. It can actually lead to decreased blood flow to those vital organs, which is, well, the exact opposite of what we want.
Wow, so it's a real balancing act. You don't want to be too aggressive with the treatment, especially if the body's already adapted to functioning at a certain level of hypertension. This is making a lot more sense now, I've got to say.
And that's exactly why understanding these underlying mechanisms, the stuff we're talking about here, it's so key to appreciating why a personalized approach to treatment is so important.
Absolutely. So let's shift gears a little bit. With all that in mind, let's talk about how we can actually identify a potential hypertensive emergency.
Hmm.
What are those red flags, those signs that should be sending us running to the doctor or to the ER? If I'm at home and my blood pressure spikes, how do I know if it's, just a bad day or a full-blown emergency situation?
That's the million-dollar question, isn't it? And the article makes this really important point. Getting an accurate blood pressure reading in the first place, that's absolutely crucial. You'd be surprised how often that gets overlooked or just messed up, especially when you're stressed.
So no more like frantically strapping on the cuff at home when I'm already freaking out about my blood pressure.
Probably not the most reliable reading, no. Take a moment to breathe. Use the right size cuff, which people forget about all the time. It's really important. Find a calm environment, and then take your blood pressure if you can.
Okay, solid advice for sure. But let's say the numbers are actually high, like legitimately high. What other symptoms should be setting off alarm bells? Should I be worried if I have a headache, for instance?
Headaches are tricky. Yeah, they're definitely associated with high blood pressure. We see that all the time. But don't panic over a headache on its own. It's not always a sign of a full-blown emergency. The real red flags you want to watch out for are things like chest pain, difficulty breathing, any sudden changes in your vision, and then, of course, any kind of neurological symptoms, weakness, numbness, tingling, confusion, things like that. Those are signs that you really don't want to mess around with.
Okay, yeah, those definitely sound like signs you don't ignore. Chest pain, trouble breathing, vision changes, anything neurological. It's go time. Get help immediately. Now, the article also mentioned that eye exams can be really revealing when it comes to hypertension. What's the connection there? What are doctors looking for?
It might sound a little strange, but your eyes are actually an incredible window into the health of your blood vessels. Doctors can see telltale signs of damage from hypertension just by looking at your eyes. It's pretty amazing.
So like what? They see little potholes in your retinas from all that high pressure traffic?
That's a pretty good analogy. They look for things like cotton wool spots. Those are these tiny white patches on your retina that indicate restricted blood flow, like mini droughts in the back of your eye. And microaneurysms, those are tiny bulges in the blood vessels themselves. And then there's something called papilledema. That one's a real sign of serious damage. If they see that, it often means rapid treatment is needed.
Papilledema. Okay, yeah, that one doesn't sound good.
It's not, unfortunately. Basically, it means the optic nerve, the one that carries all the information from your eye to your brain, it's getting swollen because of the pressure. Imagine, like, a traffic jam at the worst possible time. That's essentially what's happening in your eye. And it can lead to vision loss if it's not treated quickly enough.
So yeah, eye exams.
Yeah.
Not just for new glasses then.
Exactly. It's checking up on a lot more than just your vision, and depending on what's going on, your doctor might also order some blood tests and imaging scans to get an even clearer picture.
Which is usually where things get a little overwhelming for the average person, I think. Trying to decipher all that medical jargon and really understand what those tests are telling us, it can be a lot.
Oh, absolutely. It can feel like you're learning a whole new language sometimes. But this article, it does a really good job of breaking things down. It explains that those blood tests, they can reveal things like kidney damage, which often goes hand in hand with hypertension, unfortunately. And those imaging scans, like a head CT scan, they can rule out really serious problems like a brain bleed, for instance.
So it's really about putting all those puzzle pieces together, using those tests to paint a complete picture and figure out the best way to treat each individual person.
Mm.
And speaking of treatment, this is where things get even more interesting, because if there's one major takeaway from this whole article, I think it's that when it comes to hypertensive emergencies, a lot of times, slow and steady wins the race.
You got it. That whole bring it down fast mentality that we used to have, it can actually be pretty harmful, more harmful than helpful in a lot of cases.
Because of that whole thing we talked about earlier, how our bodies adapt to functioning at a certain blood pressure level over time.
Exactly. The article really emphasizes that most of the time, hypertensive emergencies don't require those drastic immediate interventions. In fact, aggressively lowering blood pressure too quickly can actually cause more problems than it solves, reducing blood flow to those vital organs.
So what's the preferred approach then? If we're not just slamming on the brakes, what are we doing instead?
Think long-term management. The article talks about medications that gradually bring blood pressure down over time, combined with lifestyle changes, things like diet and exercise, to really address those root causes of hypertension.
So it's about playing the long game, making those sustainable changes that stick, rather than just putting a Band-Aid on the problem.
Hmm.
But I'm guessing there are still those situations, those critical moments where immediate action is needed. Like, what if it's a true life or death emergency?
You're right. There are absolutely situations where you don't have the luxury of time, where you can't wait. The article is very clear about that. Things like aortic dissection, where there's a tear in the aorta, which is the main artery coming out of the heart, or a stroke, those are game changers. In those cases, you need careful but swift intervention to minimize the damage as much as possible.
And that's where those intravenous medications, the big guns, come into play, right?
Exactly. And the article goes into detail about why those medications are used cautiously and how the choice of which medication to use really depends on the specific emergency at hand. They're powerful tools, but they have to be used carefully. It's definitely not a one-size-fits-all approach.
Okay, so much to digest here. Accurate readings, red flags, personalized treatment, really tailoring things to the individual, that seems to be key. But this article, it doesn't just leave us there, does it? It kind of hints at this future where treatment becomes even more personalized, even more proactive. Tell me more about that.
Yeah, it definitely paints an exciting picture. There's some cool research happening. Imagine, knowing your brain's individual tolerance for blood pressure changes, like taking the guesswork out of treatment.
Wow, yeah. So not just relying on these general guidelines, but really understanding what my body needs specifically. I like where this is going.
Exactly. And the article talks about how new technologies are emerging that could make this a reality, allowing doctors to really fine-tune treatment based on each patient's unique physiology. And then there's this whole concept of blood pressure variability, how much it fluctuates over time. Turns out that might be even more important than just looking at a single high reading.
So we're talking about a real shift from this one-size-fits-all approach to truly individualized medicine for blood pressure management.
You got it. And it doesn't stop there. The article really concludes by emphasizing the importance of prevention. Because, it's always better to manage your blood pressure effectively from the get-go and hopefully avoid ever having to deal with a hypertensive emergency in the first place.
Absolutely. An ounce of prevention is worth a pound of cure, right?
Couldn't agree more. Taking care of your heart, taking care of your blood vessels, that's the best way to prevent serious problems down the road.
This whole deep dive has been, I don't know, eye-opening for sure. A little scary at times, I'm not going to lie. But ultimately, I think it's really empowering to have this knowledge.
It really highlights why understanding this condition is so important. You've got the information now, you can advocate for yourself, you can ask your doctor the right questions.
Exactly. And speaking of questions, I'm definitely going to be picking my doctor's brain about all of this at my next appointment. This deep dive has given me a lot to think about. Like, what if I could find out more about my own blood vessel health, my own personal tolerance for those blood pressure changes? It's fascinating stuff.
It really is. And that's the great thing about knowledge, right? It empowers you to take control of your health and have those informed conversations with your doctor.
Couldn't have said it better myself.
Yeah.
So to everyone listening, if you're feeling a little overwhelmed after all of this, and I wouldn't blame you, it's a lot to take in, just remember, you don't have to be a doctor to understand this stuff. The important thing is to be proactive, ask questions, and work with your healthcare provider to figure out what's best for you. Until next time, keep learning, keep those questions coming, and most importantly, take care of yourselves.